Hello, my name is Sandra Ohadugha. Today I will be presenting my presentation on my program for my CHA project with the topic of encouraging depression screening in African Americans to decrease emergency department mental health visits in Wake County. Our program focus aims to reduce the number of mental health visits by African Americans in Wake County. The reason why we are looking at the African American community in specific is because they have the highest amount of mental health ED visits in comparison to other races. African Americans in Wake County only make up 21% of Wake County's population. However, per 10,000 visits, 195 of those visits are mental health related in comparison to their white counterparts, who account for 67% of the population, only have a rate of 115 per 10,000, which is almost twice as much. Existing data shows that Wake County has a higher percentage of driving deaths due to alcohol impairment in North Carolina. Alcohol abuse is also a topic of interest in Wake County. And the reason why we decided to attend Alcohol Anonymous groups is because usually those who have substance use disorders also have depression. The county has experienced an increase in prevalence of severity and mental health substance use disorder over the recent years. At the same time, the availability of resources and access to services for people suffering with these problems has declined. Relevant information regarding HP 2020 or 2030 objectives is that Healthy People 2030, they focus on the prevention, screening, assessment, and treatment of mental health disorders and behavioral conditions. The mental health and mental disorder objectives also aim to improve health and quality of life for people affected by these conditions. This aligns with our program because we will be screening those in the community for depression with the goal to decrease mental health related ED visits in the African American community. And we will be providing resources and alternatives that they can use instead of resorting to the emergency department. When looking at other data, such as state or United States comparison, there wasn't necessarily direct information regarding African American ED visits on a country level. But looking at the state and the county, problems that exist within Wake County was the number of mental health visits related to admissions to the ED was 5 times worse in comparison to neighboring counties. Wake County is also performed 5 times worse with alcohol impaired driving deaths, their suicide mortality rate, and poor mental health days, with looking at the average number in the past 30 days, and it was age adjusted. Considering all these factors, we examined the community's needs and we decided to dive into the community and host a screening event at an Alcohol Anonymous program. Our risk group target population, as mentioned before, is African Americans in Wake County. And as previously mentioned, I chose to hone in on this population is because they only make up 21% of Wake County's population, but have twice as much mental health ED visits as any other race. We decided to start at a local or a smaller scale within Wake County. We're going to start by attending Alcohol Anonymous meetings. These meetings tend to average about 30 people per meeting. The reason why we chose Alcohol Anonymous is because typically people with substance use disorders also have depression. So attending these meetings would be easier for us to screen people for depression and offer the proper resources. And this is a chart from the 2019 Community Health Needs Assessment for Wake County, displaying the mental health ED visits results by race and ethnicity. So, as you can see, Wake County, it hasn't necessarily met the Healthy North Carolina 2020 target. The Black or African American population is almost twice as much, accounting for 195.4 per 10,000 ED visits related to mental health, even though they make up 21% of the population. And then you have the white counterparts coming in second with 113.4 per 10,000 visits to the ED related to mental health, while it accounts for 67% of the population. So we're going to screen for depression in the African American community and offer resources, um, access to healthcare, alternatives that can be used aside from the ED to help decrease these numbers. This program is based on an evidence based approach. While coming up with the program, we looked at current data, current articles that can help support our research or our purpose for this program. A few of those included topics such as social determinants of health and depression among African American adults. Another one was mental health perspectives among Black Americans receiving services from a church affiliated mental health clinic, which relates to our project since we will be attending a predominantly African American church for the Alcohol Anonymous meeting. Another one was an article discovering improving Black mental health. And lastly, another one was substance and behavioral addictions and their consequences among vulnerable populations. And for our screening tool, we chose the Patient Health Questionnaire 9. This tool was chosen because it's a scale used to diagnose depression or signs of depression to see if somebody is depressed. And it'll be easy for us to use it and conduct it to our population. It can be conducted by a provider, case manager. So those on site will be conducting these screenings with our population. So, a step by step of the screening process, we would start by engaging the audience and plan to do this by immersing ourselves into the community, by attending an Alcohol Anonymous meeting, to engage members of local mental health resources. We are choosing this setting because often depression is present in populations who are affected by substance abuse. Next, we will describe the program and the purpose of us being there to help develop rapport prior to screening. Using the Patient Health Questionnaire 9, we will then gather credible evidence and data about depression from the attendees. Depending on the scores and responses received from the individuals, we'll provide the proper mental health resources and referrals so they can directly benefit in the community of Wake County and not have to resort to the ED for mental health care. Studies actually showed that for crisis or mental health situations, it's actually better to go to a crisis clinic versus the ED for proper mental health care. And also, we will provide our own resources and alliances that we have, provide referrals so they can use our therapeutic resources as well. And then we'll make sure we provide a safe space, that be available, and a crisis intervention team with trained personnel at the Alcohol Anonymous meeting in case there is a crisis event. For our mass screening event, we will be collaborating with Alcoholic Anonymous. In Wake County area, the Tri-County Intergroup manages Alcoholic Anonymous events and programs. The event that we'll be attending that's managed by the Tri-County Group, the location will be at Jenkins Memorial Methodist Church in Raleigh, North Carolina. The date will be Sunday, August 27th from 6 p.m. to 7 p.m. This location operates Alcoholic Anonymous meetings every Sunday, but this specific date, our event will merge with their meeting. The population at this site is predominantly African American. We are starting off Sunday evenings to align with Alcohol Anonymous meetings, since many people in the community are already attending. This way, we will have an event and be sure of population access. Referral and follow-up process. So we've partnered with Alliance Healthcare. Alliance Healthcare manages all crisis services in Wake County. So we will refer attendees to our partnering providers for follow-up care. And then for our crisis or emergent situations, we'll also advise our attendees, of a crisis center where you can walk in for a crisis assessment and additional services, which will be at UNC Healthcare at Wakebrook. This is a 24-hour crisis center providing services to Wake County, and appointments are not needed. So that'll be a good source for those who have been previously attending the emergency department. Instead, we'll refer them to UNC Healthcare at Wakebrook. We'll also have members from the crisis and therapeutic centers at the event in case of an emergency, and they'll also be conducting screenings. Therapeutic and mental health care and referrals will be done through providing pamphlets, website information, phone numbers of who to contact for mental health care in Wake County. And then how will we make sure that we're culturally and linguistically appropriate? So our efforts to engage culturally and linguistically appropriately to engage, is to attend a few meetings prior to hosting the event to ensure that our demographic data is correct. Once assessed, if it is, which we already have, is primarily African American community, we will be sure to provide representation of minorities in the African American population, and that is present in our community resources and presentations. As mentioned before, our community partners are the Tri-County Intergroup and Alliance Health. So they'll be our partners for planning, funding, staffing, and implementation. The Tri-County Intergroup provides assistance for those with a drinking problem in Raleigh, North Carolina, and surrounding areas 24 hours a day. They also have a helpline. Volunteers for the helpline carry the Alcohol Anonymous message of recovery from alcoholism to those in need, offering assistance finding Alcohol Anonymous meetings in Wake County, allowing those to share their experiences and connect with others to grow. Alliance Health serves people in multiple counties in North Carolina, including Wake County, and they aim to connect people with providers that offer treatment, support for mental illnesses, substance use disorders, and care for those who are uninsured. This is imperative because lack of insurance is a contributing factor to ED mental health visits in Wake County, since many people aren't able to access mental health care, or they a lot of people aren't sure of what resources they have available to them without insurance. Another partner is North Carolina Department of Health and Human Services. They help with funding. They also work with Alliance Health when it comes to planning events and mental health programs in Wake County. Jenkins Memorial Methodist Church is allowing us to partner with them free of charge when looking at costs. The staff members at the event will most likely be volunteers. Our materials and tests that we're going to be using for the depression screening, the PHQ-9, that would mainly only require a pamphlet or paper. So as long as we have access to printer, paper, um, our budget shouldn't be towards anything. Mainly, our budget is going to be towards possibly decorations and refreshments if Jenkins Memorial Methodist allows us to. Overall, for the event, we should not go over $300 regarding decorations, refreshments, and paper for pamphlets or other resources that we decide to hand out regarding education. To reach our target population, so we're going to be trying to use ads, social media, flyers. So we'll have flyers posted on our social media pages, such our Instagram, Facebook, and our Twitter page. Tri-County Intergroup Alliance Health will ask them to post the event under the events tab on their website, which that they usually keep updated. We'll post flyers in the settings where the event will take place in Jenkins Memorial Methodist Church a few weeks leading to the event. And also, we'll give our attendees pamphlets and resources to go home with to share amongst their peers. Monitoring and evaluation of our program. When it comes to monitoring our outcomes, the outcomes that we're going to be measuring. So basically, the goal of this program is to properly address and treat depression and return to reduce the amount of mental health emergency department visits by African Americans in Wake County. The outcome that we're trying to measure would be whether or not there is a decrease in mental health ED visits and an increase of the utilization of community mental health resources that we provide. And then criteria that we're going to use to determine the success of our project. At a local level, success of this project would be determined by taking count of how many of our program attendees utilize referral services, clinics, hotlines, instead of utilizing the ED. We will provide an analysis of the program using CDC's framework for program evaluation. It's a great choice when evaluating public health matters such as mental health. Also, providing surveys um, from our attendees and stakeholders on the event and how they feel like the event ran is imperative as well. And then methods to identify lessons learned and next steps. Like I've mentioned before, the CDC framework for program evaluation will serve as a guide for us in analyzing the event and serve as a model for ways we can improve this event in the future. For our data collection plan, we'll be using the Patient Health Questionnaire 9, and we will create our own survey. The survey that we'll be creating is for review of how our program went so we can get proper feedback from our stakeholders. And here's a visual of the Centers for Disease Control and Prevention framework for program evaluation and public health. This is just a visualization of the process that we'll be using to evaluate our program, determine outcomes, and plan for better programs. With mental health needs and demands increasing in Wake County, it's imperative to provide mental health resources to proper communities and provide information on how everybody can have access to these resources. With our program, our goal is to improve mental health in Wake County's African American community, to decrease emergency department visits, providing local resources, and to collaborate with stakeholders to provide access to mental health services. Because, as mentioned in the community health needs assessment, especially since COVID, mental health demands have increased exponentially. So, this is another reason why we are conducting this program. Thank you all for listening, and we look forward to hearing from you all soon.